Today, Minister Sylvia Jones announced $30 million to create up to 18 new interprofessional primary care teams, which could include nurses, doctors, social workers, and others. In practice, MPP, what does this represent?
Okay, well, thank you very much, for having me on your show today. And first off, I don't think your radio listeners can see this, but I'm holding up the Your Health, the plan for connected and convenient care. And that's what was announced today by the Honorable Sylvia Jones, our Minister of Health. And this is basically a plan that we've been working on for some time now. Last August 2018, we announced a plan to stay open, and with several announcements and plans, even Bill 7, this is all working towards this plan that was just announced today. So in fact, our government since 2018 has increased healthcare funding by $14 billion. And with today's announcement, this $30 million that you heard about today, this is part of our 3-pillar plan, which is to create the 30 million specifically is towards the interprofessional primary care teams. And these $30 million will create up to 18 new teams. And these are Ontario health teams. So that's that specific funding. But there are 3 pillars to this plan. It's the right care in the right place. Secondly, it's faster access to care. And thirdly, it's about hiring more healthcare workers. And this is a long-term plan.
Very well, MPP. How have you seen Sylvia Jones' work since she took office as health minister on June 24, at a time when there is a lot of talk about the healthcare crisis?
Well, what I see is that we are coming out of a pandemic that really showed us a lot of weaknesses in our healthcare system. That also provided us an opportunity to see how we can fix our healthcare system. Quite honestly, Nuno, it's taken a lot of innovative, very bold, and very creative decisions in order to get to where we are today with this plan. And, if you allow me, I could talk a little bit more about this plan, because again, coming on this end of the pandemic, there are certain things that obviously we've learned about our healthcare system. And that's why it is necessary to ensure that people can connect with care where they need it, when they need it, whether it's at home, in the community, virtually, or in a hospital. And that's where this plan has come into place. So if you look at some of the things that we have announced, number one, in the right care in the right place, you probably heard this was just in the new year, we talked about minor ailments and allowing pharmacists to prescribe medication for 13 common ailments. Now, I have to tell you, just since this announcement, nearly 40,000 assessments have been completed by pharmacists, and over 31,000 prescriptions have been issued. Now, that's really significant, because when you look at that alone for minor ailments, where else would these people be going? To the primary care or into an emergency department. So again, what are our goals? We want to ensure that we have the capacity in our hospitals to be taking care of patients with some very serious and surgical requirements. So that's just one thing that we had announced, and it's amazing the number of assessments. And if you think about how that has offloaded some of the pressures on the primary care as well as the hospitals, it's pretty amazing.
Very well, MPP. Will there be any special program to facilitate the hiring of immigrant health professionals, especially from Portugal?
Oh, well, thank you. Good question. And that comes into pillar 3 of our plan, because I kind of skipped over pillar 2, but I'll come back to that to answer this question. In pillar 3, the hiring of more healthcare workers, this specifically, like over the past year, we had a record year, over 12,000 new nurses registered and another 30,000 nurses studying at an Ontario college or university. Now, international nurses, we are working with CNO to break down barriers for up to 5,000 international educated nurses so that they can register and practice in Ontario faster. So that's another thing that we're doing, because that's critical. If a nurse wants to come to our province, we want to work with them to ensure that we can avoid these barriers that take longer for them to be registered to practice here in our province. That's one of the things that we've also done. You probably heard this was, I believe, 2 weeks ago, we announced the as of right rules. And this is a first in Canada. And Ontario has become the first province in Canada to allow healthcare workers registered in other provinces and territories to immediately start providing care. So that is critical. Other things we've done to ensure that we are taking care of our health human resources today and into the future, the Learn and Stay grant. And you probably heard about this. We're expanding the program to offer more communities and more roles, not just nurses, but as well as paramedics, med lab techs as well, adding 2,500 more students to this program. New med schools, you probably heard about that, the largest expansion of medical education in 15 years by adding 160 undergraduate and 295 postgraduate positions and creating new medical school in Brampton.
Very well, MPP. My last question. Next week, especially on February 7, the meeting between Justin Trudeau, Prime Minister, and premiers of Canada takes place. What do you expect to happen at that meeting as far as health is concerned? What's your expectation?
Well, another great question, Nuno. As you're probably aware, currently the federal government provides funding of up to 22% in the Health Canada transfers to the province of Ontario. We are really hoping they will increase that to the 35%, because if they increase that to the 35%, just imagine what we could do with that funding. It equates to $10 billion a year. With $10 billion a year, we could actually construct 7 more new hospitals. We could have over 70,000 patients receiving care. We could have another 150 MRI machines that are looking to do diagnostics on our citizens here in our province so that we can faster diagnose and have better outcomes. So that's what I would hope, but I cannot anticipate what those conversations will be. All I can say is our province, we really hope that the federal government will increase those health transfers, because Ontario, we're doing our part. As I mentioned to you at the beginning, we've put $14 billion additional spending into healthcare in our province since 2018. So we're looking for the federal government to provide more of their share.